Title: The Vital Nexus, Phlebology, Dermatology, and Vascular Surgery and Comprehensive Vascular Care. Audience: medical professionals, residents, students, or at a multidisciplinary conference. Speaker: a confident, knowledgeable medical presenter. Sin Hope N A. Visual: a high-quality graphic of a cross-section of skin and superficial vein, with connections to deeper vascular structures. Speaker! Good morning. Today, we're not discussing three separate specialties. We're exploring one continuous patient journey, seen through three complementary lenses. The management of venous and vascular disorders of the integumentary system is a paradigm of modern, patient-centered medicine. It exists at a vital nexus at confluence, where phlebology, dermatology, and vascular surgery meet. Understanding this relationship isn't just academically interesting, it's clinically essential for optimal outcomes. Visual, side-by-side images, atelangiectasia, spider vein, a venous ulcer, and a varicose vein. Let's start with the patient's perspective. They rarely present with a diagnosis. They present with a concern. Doctor, my leg is ugly, itchy, and heavy. Or, this sore won't heal. Or, these bulging veins are painful. Is this a cosmetic issue, a skin disease, or a sign of circulatory failure? The answer, often, is all three. Visual: a Venn diagram with three circles. Dermatology, phlebology, vascular surgery, the central overlappers highlighted. First, the dermatologic lens. Dermatology is the master science of the intestine. It teaches us that the skin is not just a covering, it's a window. Dermatologists are the first to identify cutaneous markers of underlying venous disease. Emocidarin deposition, that brownish staining, stasis, dermatitis, lipodermatoscles, and, ultimately, ulceration. They expertly manage inflammation, infection, and wound bite. They treat the ectatic blood vessels telangiectasias with lasers and topical therapies. Their focus is the skin's health, integrity, and appearance. Then, the phlebologic core. Phlebology is the specialized study of venous pathophysiology. The phlebologist asks why. Why is there hypertension in this superficial system? They map the venous networks with duplex ultrasound, identifying reflux at the saphenofemoral junction, incompetent perforators, or deep vein obstructions. They are the therapeutic interventionalists of the superficial system, using endothermal ablation, sclerotherapy, or mechanochemical techniques to seal faulty veins. Their domain is the hemodynamic correction of the superficial venous system, alleviating the underlying cause of the patient's symptoms. And finally, the surgical and deep system expertise. Vascular surgery provides a structural and deep system perspective. Their focus extends to the deep venous system, major venous outflow obstruction, complex congenital malformations, and advanced deep venous reconstructions. When disease is no longer confined to superficial tributaries, when there is deep vein thrombosis, post-thrombotic syndrome, or severe deep valvular incompetence. The vascular surgeon's skill in open and endovascular procedures is irreplaceable. They manage the most severe sequelae, often where phlebology and dermatology meet their limits. Visual: an animated flowchart showing a patient's pathway. Symptom: dermatology, diagnoses, wound care, phlebology duplex, ablation greater than vascular, surgery deep system intervention, ongoing care. The confluence in practice. A case of venous ulcer. 1. Dermatology diagnoses the ulcer, rules out arterial or other causes, initiates advanced wound care, and manages the surrounding dermatitis. 2. Phlebology performs duplex mapping, identifies and treats the superficial reflux, feeding the ulcer bed, reducing venous hypertension. 3. Vascular surgery would have been involved from the start if there was significant arterial disease or deep venous obstruction, and remains available for complex cases. This is not a linear handoff. It's a collaborative triangle. Regular multidisciplinary team meetings are where the magic happens. The dermatologist reports on wound healing progress. The phlebologist shows hemodynamic improvements on ultrasound, and the vascular surgeon assures the deep system is competent. This collaboration prevents siloed care. It ensures the patient with a cosmetic spider vein isn't missing an underlying deep insufficiency, and the patient with a surgical varicose vein gets the most minimally invasive option appropriate for them. Visual. A split screen showing before, after photos of a limb with healed ulcer and improved skin quality. In conclusion, the future of managing venous and cutaneous vascular disorders lies in embracing this confluence. By fostering mutual respect for each specialty's domain of skin, the superficial veins, the deep system, we create a seamless continuum of care. We move from treating lesions to treating people, from addressing symptoms to correcting pathophysiology, and from providing fragmented interventions to delivering truly comprehensive, holistic healing. The patient with a leg condition doesn't need just a dermatologist, a phlebologist, or a surgeon. They need the power of the Nexus.